Well, good afternoon, everyone, and welcome. Thank you for joining us this afternoon. I'm Chris Reynolds, Manager of Support Services at Employers Health. I'm pleased to be joined today by Ernie Bourassa, Vice President of Employer Solutions at Naviguard, and John Prible, Vice President of External Affairs at UnitedHealth Group. Today, they will be discussing legislative solutions and important elements of surprise billing reform, as well as how UnitedHealthcare is helping reduce surprise billing. But before we get started, let's go over a few housekeeping items. All attendees are currently in listen-only mode, so please send any questions you may have using the questions function in your control panel. We look forward to addressing all your questions at the end of the presentation. If you have any difficulties hearing, please raise your hand in the control panel and we'll be in touch to assist you. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities. And with that, I'm going to turn it over to Ernie and John.
Thank you, Chris. This is John Prible, again, Vice President of External Affairs here with UnitedHealth Group. Just a little bit of background on myself so you know who's speaking here. I've been with UnitedHealth Group for about 5 years now. Before that, I worked for a trade association, an insurance trade association in Washington, D.C. And then before that, spent about a decade working on Capitol Hill, doing legislative policy work, mainly in healthcare, finance, and actually financial services issues. So that's a little bit of my background. My job here with External Affairs is really external advocacy for the enterprise. And one of the key projects that I've been working on for the better part of the last 18 months or so has been the issue of surprise billing. Surprise billing, as I think probably everybody on the call is familiar with it, is generally a term used to describe balance billing, where consumers may be going to an out-of-network provider, may or may not know of that. Usually, it's an emergency in an emergency setting, and they get a bill, an out-of-network bill that oftentimes is considerably higher than their expectation. As it stands right now, there are approximately 22 states that have taken some legislative measure to rein in surprise billing or prohibit surprise billing. But all 50 states have not taken action. And really, it does require the federal government to actually enact meaningful regulation across all of the segments of the healthcare industry, some of which are regulated by the federal government, some of which are regulated by the state government. Here at External Affairs, I was actually just chatting with Ernie a little bit ago. Here at External Affairs, you may think of us as an organization that is really devoted to looking at what Capitol Hill and specifically what the White House and House and Senate are doing. But actually, there's about 35 of us on staff in External Affairs. About 20 of us are actually located across through the states because obviously healthcare is just such regulated in a state-specific way in many cases. And so we like to be on the ground in various states in order to, both ascertain what kind of the political environment is, and then also affect change and advocate, on both our clients and our beneficiaries' behalf. When it comes to surprise billing, this really was a kind of a state-specific. They identified the problem well before the federal government did. But the problem, once it started to be really analyzed at the federal government and across the nation, quickly drew the eye of people that recognize that surprise billing is a problem for affordability. Healthcare spending, this is nothing of any surprise to any of us on this call, I'm certain. But healthcare spending continues to skyrocket. It is nearly $4 trillion in 2019. It'll probably exceed that number here in 2020. Expected to exceed 5.7 trillion in 2026. Healthcare costs have a real impact on American families. The healthcare costs have a real impact on our consumers, and therefore healthcare costs have a real impact on UHG's reputation, our the way that people view us, our believability, and so we really, about 18 months ago, took a hard look through some of our research at what were some of the drivers in the increased healthcare costs. And one of them that we really recognized early on was in emergency department visits. And one thing that we quickly realized, we actually have an entire research team, and we quickly saw that roughly 1 in 5 emergency department visits involved care from an out-of-network provider, and that could result in a surprise out-of-network bill. And so moving on to the next slide, Ernie, if you don't mind, sorry.
Next one, John.
So as you can see, as you can see from the slide, I'm not going to read all of these bullets. I went over some of them, but we quickly recognized that this is a real problem for affordability, and there was a real opportunity for Congress to actually make a difference. And quite frankly, one of the other things that we realized, not reflected on this slide, but it was surprise billing very often is it's a concentrated problem within very specific and certain marketplaces. And so a certain market might have an exorbitant amount of surprise billing, and another market may not have, very much surprise billing at all. And so we recognize that early on, and I think Ernie will probably go into a little bit of that and how that influences, some of our decisions as a company. But it certainly also influenced, the advocacy that we adopted, again, when we started to look at this about 18 months ago. So just on the next slide, want to really stress that from our perspective, the issue of surprise billing presents an opportunity to cut costs. And again, I'm not going to read all these bullet points, but one thing that I really want to kind of hammer home is we've actually had numerous independent analysts, as well as the nonpartisan Congressional Budget Office has done studies on surprise billing. And what they've universally concluded is that depending on the solutions that Congress takes to regulate and to prohibit surprise billing, these solutions could present a savings to the entire healthcare system in the order of magnitude of roughly, again, depending on what the approach is, roughly about $14 billion over 10 years to as high as $25 billion. And I, fully recognize that in this current environment, when we're talking about COVID-19 costs, and we're talking about unemployment assistance and emergency vehicles that Congress is passing that are in the several hundreds of billions of dollars. $25 billion may not pop out at you, but I assure you, when we return to regular times and before kind of this upheaval that we're going through right now, $25 billion in the healthcare system is real money. And so it really demonstrates the amount of kind of waste that is out there that is possible to be reined in. Now, so as I said several times, about 18 months ago, we started looking at this. About 12 months ago, we collectively as an enterprise with our senior executive team adopted a recommendation. And I should say this is actually very rare that UnitedHealth Group as an enterprise will go on the record in recommending specific policy solutions for Congress. But in this case, we did. And so what our recommendation is that there be a prohibition placed on surprise billing. And this is the next slide dealing with solutions, that we eliminate balance billing by care providers, both for emergency services or when they receive care from an out-of-network provider at an in-network facility. And that would include labs, DME, and that be a blanket prohibition. And that consumers, their costs be capped to out-of-pocket costs at the same level as in-network cost sharing. So essentially, the consumer would not feel, they would not even recognize or know that they have been subject to a balance bill or a surprise bill. In addition, we strongly recommend that there be increased consumer transparency in terms of hospital notification when a provider is out of network. And so that way, and again, we do recognize that, it is not always the case that a consumer has the ability to choose what services or who is performing the service on them, depending on an emergency situation where, for example, they literally may not be conscious and able to make that decision. But when there is an opportunity to choose, we recommend that there be that transparency so that the consumer can make that determination. Now, in the cases where a consumer or a patient is actually seeing, because of circumstance or whatnot, seeing an out-of-network provider, and we do not have a network contract with that provider, then we would propose that Congress establish a benchmark rate that is the median in-network geographic rate to determine the amount of reimbursement to that provider, hospital, lab, etc. And that our belief is that median in-network benchmark rate should actually not impact the contracting negotiations between, for instance, UnitedHealthcare and a group of providers. And in fact, it would only increase the importance of that in-network negotiation. And finally, we would recommend that that any proposal either limit or not have arbitration at all. And some physician groups, this is where we differ with some of the physician groups, because some physician groups feel strongly that there should be arbitration. That is the ability, if there's a dispute between, for instance, the median benchmark rate and what they feel is an appropriate rate, that they should have the ability to take that to arbitration to appeal the amount. And, some people are saying, well, shouldn't they have the ability if it's in a high cost area, if it's a complex special needs case that ends up costing more? Our response is that arbitration increased costs, it increased complexity, and it increases administrative burden and the delay on getting a resolution to the payment. And that, each one of those kind of extraneous factors that I listed just a second ago, the kind of geographic price, the complexity, those are all taken into account already in both the geographic median in-network rate, but then also in the coding of the coding practices in an emergency room. There are obviously different codes for different severities. And so those should be largely taken care of already. One of the reasons, though, that we quite frankly think that arbitration should be either not be put in place or be very limited is because arbitration does drive up costs in the overall healthcare system. When I earlier referenced the CBO and other nonpartisan experts estimating that a solution to surprise billing could save between $14 billion and $25 billion. The $14 billion was the approach with arbitration, and the $25 billion was the approach without arbitration. So there's a significant increase in the amount of savings that could be achieved to the healthcare system if there is not arbitration. So real quick, to close up my portion, these are the recommendations that we have provided to Congress. Again, I will say, I've been here 5 years. This is, I think, the only time in my recollection that we have gotten to this granularity of specifics in terms of real recommendations of how to solve, a pressing issue facing the healthcare system, and really put this much pen to paper. And I think that speaks to the importance that this issue has to our organization and to our enterprise. Where we stand right now in terms of congressional action, there was a lot of action last year on this. Several different committees passed various versions. The version that advanced the most through Congress actually was our preferred solution that had a median in-network benchmark rate, a prohibition on surprise billing, transparency provisions. It did include arbitration, but it had very tight guardrails on the arbitration, which we were actually comfortable with. It advanced relatively far. It made it through one Senate committee, made it through 2 House committees. There was actually a deal between the House and Senate last December on this. And it really just fell apart at the last minute, not necessarily due to the issue of surprise billing, but larger larger things at play, including federal government funding. And then we were very hopeful at the beginning of this year that we were going to, continue the momentum that we had from last year and make some meaningful progress. And then, I'll just be frank and say COVID-19 happened, and all the legislative focus since the beginning of March has been focused on response to COVID-19, and not a lot of effort on other issues, including surprise billing. I will say that, and this is going to conclude my remarks. Well, no, actually, I want to make one outlook kind of forecast, but I will say the one positive in terms of just strictly related to surprise billing as it relates to COVID-19 is, as you all are aware, there was a lot of emergency funding made available for providers, first responders, hospitals, as part of the congressional kind of emergency funding vehicle. As a part of that, the White House actually, the administration put in rules that do not allow this emergency funding to go to any providers that conduct surprise billing or any balance billing as it relates to COVID-19 treatment, testing, or going forward, any potential, novel treatments or vaccines. And so that is a regulation that the White House just recently put in place. And Congress is very supportive and will likely write into that into actual law on their next COVID-19 response whenever that emerges. I say that because that gives us a glimmer of kind of what is potential in the future, which is even though all eyes are directed on COVID-19 right now, people are very aware of the issues regarding surprise billing and the impact that it has on consumers, patients, families. And I think, whenever we see some sort of return to normalcy, this will be at the top of the list of issues for Congress to address. So, Ernie, that concludes my portion. Happy to turn it over to you, and then of course deal with questions.
Thank you, John, and thank you everyone for taking time today to hear about UnitedHealth Group's perspective on surprise billing, and also to hear about a new out-of-network solution that we've developed at UnitedHealth Group called Naviguard. And my role in the session today will be to give you some insight into what Naviguard is and how it addresses the problems that John was talking about. You know, as you listen to John, I think it's fair to say there's some uncertainty about if and when federal legislation will pass. What I would offer is that even if there is some legislative event, it would not completely eliminate balance billing and the exorbitant costs associated with those balance bills, because of the fact that there will still be members that choose to use their out-of-network benefit that their medical plan offers them for whatever reason. They will choose to use a provider that's not in the network. And also, legislation would do nothing to change how providers and how much providers that are not in a network bill for their services. And so what the Naviguard solution will do is address this problem in two ways. One, by providing some very extensive member support and advocacy when members are in a situation where they're dealing with a balance bill from an out-of-network provider, whether that's a surprise or not. And also by changing the way that the reimbursement is the allowed amount that's the provider receives, to change the basis for determining that allowed amount. Just some additional context here. You may know that some providers that are out of network, they actually like being an out-of-network provider. They choose to be an out-of-network provider in terms of their, I'll say, business strategy. And that has a lot to do with the fact that when you're an out-of-network provider, how much you charge for your services is really not controlled or limited in any way. You can charge whatever you'd like. And a lot of employers, and through their medical plan, use a really traditional way of reimbursing those out-of-network claims from those providers, and that reimbursement approach is generally referred to as reasonable and customary, where the amount paid is a function of the amount charged by the provider. So the more the charges increase, the more the payments increase, and essentially that environment just emboldens providers to remain out of network. Additionally, you may know there's been a lot of press about this. Many providers who are really advantaging themselves by balance billing and charging a lot are what we refer to as hospital-based physicians, anesthesiologists, emergency room physicians, and many of those physician groups are actually owned these days by private equity firms. And those firms are very astute at developing strategies that can really maximize revenues by this notion of balance billing and receiving reimbursement that's based on what we refer to as reasonable and customary charges. If you think about the dynamic that occurs traditionally in the out-of-network space, and in this example, we're referring to UnitedHealthcare here as the health plan. UnitedHealthcare certainly interacts with patients, members in a variety of ways. UnitedHealthcare certainly interacts with out-of-network providers, but those interactions with those providers are usually around contracting attempts, negotiating with those providers to bring them in network, if you will. But the space that's really uncontrolled or unmanaged is everything that occurs between the out-of-network provider and the patient. Again, how much that provider charges, whether or not they choose to balance bill, how aggressively they balance bill, is all something that traditionally the health plan has not played an active role in. And with Naviguard, we're bringing to market a solution that will intervene on the left side of this circle here and help members when they are faced with an out-of-network balance bill. If you think about this dynamic too, the way we think about it is there's really two scenarios that play out. The one that's more straightforward is represented on the right side of this slide here. We call these a member choice scenario. So this is your situation where the member chooses to use an out-of-network provider, either someone they were referred to or a provider that they heard about through the media or what have you, but that's a member choosing to use their out-of-network benefit. The more complicated scenario we refer to as the no choice scenario, and this is really where a lot of that surprise billing that John described occurs. So this is the scenario where a member is doing what we want them to do. They're using a network facility, and the physician that's treating them may actually be in network, but unfortunately, some of the providers who are also treating the member in that network facility are not in the network. They are, for example, an emergency room physician who is out of network, or an anesthesiologist, or a radiologist, or an assistant surgeon that is not in the network. So here we have the scenario where that balance bill is going to, unfortunately, quote unquote, be a surprise to the member. And in either case, I think it's fair to say that the member experience is pretty lousy. Not a lot of support, not a lot of resources, not a lot of guidance in terms of how do I deal with this balance bill, how do I respond to the provider. So the Naviguard solution is really attempting to take that poor member experience and turn it into a much more positive one. I should mention that UnitedHealthcare clients will be the first Naviguard clients by virtue of the fact that on October 1st of this year, we will be offering the Naviguard out-of-network solution to all UnitedHealthcare employer clients in our commercial line of business. Particularly, we believe that this solution will be ideal for a client that is still using that reasonable and customary reimbursement methodology for paying out-of-network providers, because that's where we can really make a difference in terms of member support and in terms of reducing some of those exorbitant out-of-network costs and balance bills. We do have membership, a sizable block of membership that's been in a pilot for about 6 months, about 150,000 or so members by next month, by June, will be in the pilot. And we're encouraged by the results that we're seeing in terms of savings, reducing those out-of-network costs, in terms of ability to negotiate on behalf of members with providers that are balance billing certain members, and encouraged by some really great feedback from members who seem to notice the difference that in their experience because of the service and support which Naviguard provides, and I'll explain more specifically what that support consists of in a subsequent slide. So again, Naviguard is fundamentally a solution that will both reduce the cost of out-of-network utilization, while at the same time providing member support and advocacy to those members who are being balance billed, again, regardless of whether that balance bill is a surprise or not. So both, first, a little bit more information in terms of that cost reduction that I've referred to. When we look at the savings that result from a reasonable and customary reimbursement methodology, and when I say savings, I'm referring to savings off of the billed charge, the amount that the provider charges. that equates on average to about 55% savings. Last year, UnitedHealthcare introduced another out-of-network program that attempted to change how those out-of-network claims are paid using more of a reference-based, what's referred to as a reference-based pricing methodology. And through that solution, UnitedHealthcare was able to increase the savings for those clients who adopted this particular solution from 55% to about 60%, while providing some support to members in terms of trying to negotiate with providers that were balance billing. With the Naviguard solution, we're really ramping up what we can achieve in terms of savings, again, by using a reference-based pricing methodology, not a reasonable and customary charge-based methodology, while at the same time providing much more member support and advocacy, which I'll explain in just a minute. So the support that I'm referring to really takes the form of three different elements, if you will, which again goes on top of a different pricing methodology. The first element of support comes from a website, which we have named Naviguard.com. The website exists. You could check it out if you're curious. I'll show you some screenshots at the end of my remarks, but it's basically a website filled with various types of practical tools, educational information, tips on what to do, what information to have at hand if a member finds themselves being balance billed by a provider. So just practical tips and educational information, which we will be adding to as we go forward and evolve the Naviguard solution. The second element of support is really think of it as a concierge-like one-on-one member advocacy service, whereby when a member informs us that they have received a balance bill, Naviguard will assign an advisor to that member, and that trained advisor will stay with that member until their balance bill issue is resolved. So a one-on-one point of contact. The member will have that person's name and number, will have direct access to that person, to that advisor. The advisor will keep that member apprised of what the status of the resolution is, what the timing of the resolution is. So just really making that member feel like they've got somebody working on their behalf. And then the third element of support labeled here as balance bill negotiation. Naviguard has a team of trained negotiators, and when a provider is balance billing for the amount above the paid amount on the claim, these negotiators will contact those providers, and if they cannot convince that provider that the amount that was paid was reasonable, and the provider continues to balance bill, the negotiator will be trained to, in some cases, negotiate an additional payment or increase that allowed amount in return for a clear commitment from the provider to stop balance billing, to basically take the member out of that difficult situation. In addition, these negotiators, because they will be dedicated to this task, they will be identifying trends, either things that they're seeing at a geographic market level. John mentioned surprise billing is more pervasive in some markets than others. Texas is certainly one example of a market where a lot of this activity occurs. So looking for trends at a market level, trends with a particular provider, trends with a particular provider specialty. And where we see those trends, Naviguard will leverage other UnitedHealth Group resources, payment integrity, fraud and abuse, network contracting resources to try to deal with that situation more holistically, in addition to resolving an individual member's balance bill situation. So very extensive, multifaceted member support and advocacy. A little bit more information on the, excuse me, different reimbursement methodology that I referred to. The industry term that I'm sure have heard about or read about that's used and that's applicable here is reference-based pricing. The idea here is simply that the amount to be paid on that out-of-network claim, instead of being a function of what the provider chooses to charge, the pricing or the reimbursement is a function of various other factors, including things like the place of service. Was it in an ambulatory care setting or a hospital setting? The provider specialty type. Geographic adjustments, obviously the cost of care and what is a competitive reimbursement for a particular claim in Texas is going to be different than it is in Kansas or New York City or Northern California. Looking at industry benchmarks as well in determining that reimbursement amount. For example, what does the health plan, in this case UnitedHealthcare, pay in-network contracted providers for same or similar service in that particular geographic market? What do government programs pay? What is the Medicare rate for a particular service? So all of those factors come together to formulate a reimbursement for a particular service on a particular member that, again, is not influenced by or dependent on the amount that the provider chooses to charge for his or its services. And again, couple that with a team of negotiators that can intervene in those situations where it's necessary to try to convince that provider to accept the amount that was paid or accept perhaps an adjusted amount, again, in return for a discontinuation of the balance billing. So at the end of the day, the goal here, as I mentioned earlier, is to reduce costs for employers and members when they're dealing with an out-of-network claim situation, but also to considerably change the member's experience going through that process. And the reasons that we're confident that Naviguard can really make for a much better, much different member experience is because in addition to having that one-on-one support from a dedicated Naviguard advisor, we know that we can save the members' time, the time they have to spend worrying about and dealing with this situation. We can give more clarity to members so they know exactly what's happening, how we're approaching resolution of their issue, what the status and timing is of that resolution. And through that process, just educating the member so they understand more now about how to recognize a balance bill situation or a potential balance bill situation. And at the end of the day, just creating a much more satisfied experience for the member. And lastly, I'll wrap up here with just this slide, which is shows a couple of screenshots from the Naviguard.com website that I mentioned. Again, it's just tips, tools, information that can help a member deal with one of these situations or recognize a balance bill situation perhaps more effectively than they could have previously. Some members may want to just avail themselves of this information before they ask a Naviguard advisor to get involved. So we will continue to build out this website with this kind of information to make it of benefit and usefulness to members that have the opportunity to utilize Naviguard and Naviguard.com. So that is the end of our slide material. At this point, we'll turn it back to Chris, who I think is going to coordinate some questions and answers.
Thank you. So if you have any questions, please use your control panel and type those in, and we can read those to the group. I did have a question regarding implementation. So what's the timeline or time frame look in terms of implementation for Naviguard?
It's similar to other solutions that employers will access through UnitedHealthcare. So I would say to be safe, 30 to 60 days is probably sufficient time to do everything that's involved in implementing the Naviguard solution or changing from whatever out-of-network solution is currently being utilized to the Naviguard solution. More time, the better, obviously, but I think that's probably the safe window.
Okay. See if we get any more questions.
Hey, Chris. Hey, it's John. While you're kind of looking through whether there are any more questions, did want to raise one point that I kind of glossed over at the beginning when I was talking about the legislative forecast. And you know, it was raised after the fact, but I do want to highlight the potential for Congress taking this on and developing a legislative solution this year. With everything going on with COVID-19, I just don't want to overplay that. I think it's very unlikely that Congress does anything in this legislative year, and we're probably looking at a more long-term horizon. So I did want to clarify those comments. Didn't want to leave people with the wrong impression.
Perfect. Thank you. Well, I'm not seeing any more questions coming in. If anybody does have any questions later on, you feel free to send those to your account manager at Employers Health or anyone at Employers Health, and we can help get those questions answered. I want to thank everybody for joining us today. I hope you and your families are staying safe and healthy, and have a great rest of your day. Thanks again.